Okay, so after you've identified the need for your review, so nobody out there has done something similar, it looks like you can actually make a unique contribution, then this is where I say you would go and do a scoping review of the literature to try to get a feel for prior systematic reviews on the topic, but also to get a feel for the types of primary studies you actually want to include in your literature review. I think this is probably one of the most important steps in a systematic review, and it's one that people omit all of the time. And you can tell because when people are not familiar with the literature they're trying to synthesize, it shows. And so hopefully all of you have a good idea of, oh yeah, I'm thinking of this one study that I read, it was this RCT looking at the effective in intervention. It was a really high quality study. I want to review studies that are similar to that, right? So if you don't have that idea in your mind, that means that you're going to have some difficulty when you're coming up with your coding manual and coming up with this your eligibility criteria. So the first thing you should do is go to the literature and just do a naive search. Okay, so this doesn't have to be the comprehensive literature searches we're going to talk about this afternoon, but just do a naive search to try to find those types of studies that really are the quintessential studies you're interested in and you're interested in synthesizing. And so this, just by getting a feel for the literature and getting a feel for the studies that exist, you can help broaden or narrow your research question. You can help identify potential items that you'll want to code that might explain variability and effects that you're seeing. But it can also be useful for developing search terms, which we'll talk about this afternoon, because once you start to see the language that folks in the literature are using, that can help you develop synonyms. So for instance, a lot of the work that I do focuses on delinquency. Well, there are 501 synonyms that people use for delinquency. Some people call it externalizing behavior, some people call it conduct disorder, some people call it acting out, behavioral problems, behavioral disruptions. We could go on and on and on. And so by just doing a naive search of the literature and finding the terminology that people are using, this can be very helpful, I think, especially in the social sciences where we are perhaps a little bit, we have more synonyms for the terms that we like to use. So do a scoping review or a scoping search first, just to get a feel for what are the types of studies you're interested in, what's the terminology that they are using, and what are some potential sources of variability you might like to look at later. So your next step then, so you've identified the need for the review, you have scoped the literature so you have a good idea of the types of studies you're going to be synthesizing. Now you need to create your review team. Okay, and so you should be thoughtful about this because first of all, it does take a team. You can't do a systematic review alone, or you can, but it probably won't meet the highest quality standards. And so you obviously want content experts, right? So these are the people who actually know and work in this field, are substantive content experts. So in our dropout prevention systematic review, we had several consultants on that project who were the people who were actually doing the trials in the field for these dropout prevention programs. Because actually, I was more of a methods expert. I wasn't a substantive content expert. So we needed to bring those people in so that we would have that content expertise. You definitely want methods experts as well. So this can vary depending on what level of expertise you need. Information retrieval, so if you have librarians at your institutions or Campbell can put you in contact with librarians, it's often a good idea if you're going to be doing large literature searches to have some information retrieval specialists on your team or at least as consultants to help you through that literature search stage. If you're going to be doing a meta-analysis, so quantitatively pooling results across studies, it's a good idea for at least someone on the team to have some statistical expertise, either in meta-analysis or as a statistician who can pick up the meta-analysis techniques. And then if you're going to do any other kind of specialized synthesis, so if you want to synthesize qualitative research, if you want to synthesize economic research, you probably might need an expert for that. Some other folks that you might want to consider including in your review team are stakeholders or, advisory group people. So this, if you're interested in patient-centered research, this might actually be patients or participants. This could be other researchers or policymakers or practitioners. But the goal here is to have some stakeholders or expert panel members who might be able to provide feedback on your protocol, provide feedback on your research questions to make sure that you're actually asking questions that they care about the answers to. Right? And so this is the whole movement towards patient-centered outcomes research. We want to ask questions and do research that actually matters to patients and policymakers. And so really the stakeholder advisory group participation, I've seen that work in many different ways, but often it's kind of at a higher level, providing feedback on protocols and providing feedback on completed reviews. Any questions about that? Compiling a review team. And I would say that's one of the benefits of working with Campbell and being connected with the Campbell collaboration is that perhaps you don't have methods experts that you know to ask to join your team. We can put you in contact with those people. And so that really is the benefit of working with the collaboration, is that we can provide that assistance to our review teams and our author teams. If they need a librarian to assist, we can provide that contact information. Yes?
So are those people consultants? Are they affiliated? Do they already have jobs? Or
it depends. Most of the people they already have jobs, so they're people like you or me who are known to the collaboration and who are willing to work as either a paid consultant or as a co-author. Other questions? Okay. So let's talk about defining your research questions. And so really, all systematic reviews will start with a protocol, and the most important thing in the protocol is going to be your research question. So what are you trying to address in the review? And so really, when we think about research questions, I like to think about those as framing the conceptual boundaries of your review topic. So what populations are you interested in? What interventions are you interested in? And then eligibility criteria, and I've used this term quite a bit this morning, those really are the ways that you operationally define each of those key concepts in your research questions. And so really the eligibility criteria, the reason that we use those and we specify those in a protocol is in the interest of transparency and replicability, right? Because we want to overcome those limitations in those traditional unsystematic reviews where who knows how you picked which studies you reviewed, right? We want to have very clear criteria that you have to do X, Y, and Z for that study to be included in this systematic review. That's the purpose of your eligibility criteria. So when you're formulating your research questions, there are really two kind of broader issues that you need to consider. First is, what's your specific hypothesis of interest? Okay, what are you interested in? Two, what type of primary research evidence is relevant to that hypothesis? Okay, so big picture, what are you interested in? And then more narrow, what kinds of studies are going to provide the evidence you need to address that specific research question? So as I mentioned before, most of the examples I'm going to be using today, because we're talking about Campbell systematic reviews, will be research questions focusing on intervention effects. And really, these are kind of the most straightforward types of systematic review topics, especially when we think about meta-analytic methods as well. But here's an example of a question you might be interested in looking at intervention effects. Are function-based antecedent interventions effective in reducing disruptive behavior in young children? Okay, so that's a research question that you might be interested in. And I don't know if anybody in here is an expert in this type of an intervention, but these types of interventions are typically used in single case design research studies. So by the way that we have actually asked this question, it's almost implicit that the types of studies that are going to provide the information useful for addressing this are going to be those single case design studies that look at a function-based intervention and follow children's disruptive behavior before and after that intervention. But you can also ask questions about associations. Okay, so I just want to make it clear that we don't have to only focus on intervention effectiveness questions. You can actually be looking at the correlations between some variable X and some variable Y. So you might ask, what's the relationship between teacher training levels and student achievement? Okay, and if we think about the types of studies that might give us evidence relevant to this research question, probably most of those are going to be observational, correlational research designs where they're predicting student achievement outcomes using some variable indexing teacher training. Okay, so you can answer those types of questions with systematic reviews and meta-analyses. You can also answer diagnostic and prognostic questions. And I don't think we'll go too much into that at all tomorrow with the meta-analysis because really these require a whole different set of statistical tools. But the systematic review concepts are going to be the same. So you might ask, which risk assessment tool, A versus B, is a better predictor of reading disabilities among young children? Okay, and so we know that by asking this type of question, the types of studies that are going to be relevant are those comparing two assessment tools to each other. So there are a broad array of the types of intervention questions you can ask, but the first thing that you need to think about, okay, what are you interested in? And then this is going to follow pretty clearly into the types of primary studies or primary research evidence that will be relevant. Now, when you're thinking about developing your research questions, a big issue, which we've already sort of touched on, is the scope of the question. Do we want to go broad or do we want to go narrow? Okay, and there are pros and cons to having broad versus narrow review scopes. So if you have specific narrow questions, these are very useful if you're interested in testing, for instance, brand name intervention programs or packaged programs, or if you're interested in looking at the effect of an intervention for a very narrow type of population. But kind of broader mid-range scope questions can be useful for looking at kind of non-branded programs that may have a kind of a general focus. So for instance, in my research in substance use, there's a big movement towards these packaged programs like functional family therapy. Okay, and so this is a packaged program that you can use to then provide family therapy for kids who have substance use problems. Well, in some of my meta-analyses, I've said, well, I'm not just interested in functional family therapy, but I'm interested in family therapy in general. And then I can actually look to see, well, does functional family therapy versus kind of a generic family therapy, do I actually see a difference in effects? So by asking those broader questions, you have more variability that you can then play with in your analysis. And then I think at the kind of broader level, the largest, broadest types of questions, like the dropout prevention program type of question, again, can allow you to explore that variability, but can also be useful for generating knowledge and generating new theory on an intervention. So I think probably one of the most famous criticisms of, or really one of the famous sort of things that comes up in meta-analysis, probably many of you have heard the criticism of combining apples and oranges. Right, and so that's often leveled against these broad research questions. Oh, if you're focusing on mentoring, career counseling, academic advising, and you're pooling those all together, you're mixing apples and oranges, and so you're getting kind of a meaningless result. Well, one of the famous meta-analysts in the fields, I guess it was in the late 70s, said, well, sometimes I'm interested in apples and sometimes I'm interested in oranges. Sometimes I'm interested in fruit salad, okay? And sometimes that variability is actually interesting. Sometimes I care about that, and that's what I want. And so really this scope of review question is an apples, oranges, fruit salad question. And it will have implications in terms of the analysis that you do and how you write up your results and how you interpret those results. Because if you do a fruit salad type of review where you're including broad types of program categories or outcomes, you need to be sensitive and thoughtful about that when you're interpreting your results. I would say those Granny Smith apple reviews that are very narrow can be very useful, but sometimes can be circumscribed because they don't have that generalizability that the large reviews have. So it's something to think about, and as we work through your own research questions, we can think about kind of pros and cons to having a larger, broader versus narrower review scope. So I'll pause there. Any questions? Okay. So when thinking about the types of primary research designs that are going to be relevant to your research question, really we'll think about the participants and the types of interventions and comparison conditions and maybe outcomes. But really an important thing for you to start thinking about, and this will become even more clear tomorrow when we work with meta-analysis, is thinking about the types of study designs that you think are going to provide relevant, credible evidence for your research question. So many Cochrane and Campbell reviews do focus either solely on randomized controlled trials or randomized controlled trials as well as quasi-experimental controlled studies. Okay, because most of our studies were interested in looking at intervention effects. We say, okay, if we want to make causal claims about those interventions, we know that the study designs with the highest internal validity will be those RCTs or those QEDs. But I want you to be aware that that does not mean that those are the only types of study designs that can provide credible evidence, because it depends on your research question. For instance, that research question about teacher quality and student achievement. I guess you might have some studies where you randomly assign teachers to be low quality and high quality, but probably not, right? So if that's your research question and you say you're only going to include RCTs, you're not going to have any studies to synthesize, okay? And so it will be probably very appropriate for you to include observational or correlational research designs. Now, I know in the field of disability studies research, many of you may be interested in topic areas where single case designs are going to be providing relevant findings, and that is also acceptable. So I don't want you to think that RCTs and QEDs are the only types of research designs that can be included and synthesized in a systematic review, because it depends on your research question. But because of the types of questions that are typically covered in a Campbell or Cochrane review, we do tend to see that focus just on RCTs or QEDs. Yes, Judy?
Could you talk a little bit more about what a quasi-experimental design is?
And so when I'm talking about a QED, I mean a controlled quasi-experimental design where you're comparing two groups, but those two groups, units have not been randomly allocated to those two groups. So for instance, in my field in substance abuse research, we often might compare cognitive behavioral therapy versus family therapy, but kids might get into those two different conditions based on their preference. So if we let participants self-select into CBT versus family therapy, or if we assign them by some other non-random mechanism. So self-selection is, most obvious. Sometimes you'll see people use retrospective data where they'll create a comparison group based on retrospective data and then use propensity score matching to try to get their groups equivalent. So anytime you're comparing two groups and the people have not gotten into those two groups via random allocation.
So could that be some kind of a trial?
I would say it's a quasi-experimental trial, yes. Absolutely. Stephen?
Can you weight those differently in RCT versus a quasi-experimental and the outcomes of your systematic review?
So I would argue that we will not weight by quality of any kind, and we'll talk about that this afternoon. So you absolutely could. You could upweight the RCTs and downweight the quasi-experimental trials. At Campbell, we typically do not approve any kind of quality weighting, and it's only because sometimes as scientists we feel that RCTs have the best internal validity, but we know that there are many RCTs that do not yield equivalent groups. If you've got an RCT with high attrition, that actually might have lower internal validity than a really well-done quasi-experimental trial. So at Campbell, at least, we do not advocate, weighting, and instead what we say is if you want to say, well, I'm not going to trust the results from a QED if it's got substantial baseline non-equivalence, then you need to actually have that built into your eligibility criteria. You need to say, I'm only going to take the highest quality studies, and if something falls below some quality threshold, then you should exclude it. But don't upweight and downweight just because it gets a little risky.
Sure. Thank you.
Yes?
Does Cochrane collaboration include observational or correlational designs or mixed methods synthesis?
Sometimes they do. Yes, but Cochrane has hundreds of review groups. So it really can vary quite a bit depending on the review group. The public health group, which is I'm most familiar with, they certainly have reviews that might include observational designs. Now, I should point out, though, that if you did have data from these different types of designs, in a meta-analysis, you would typically meta-analyze them separately. So you would meta-analyze your single-case design studies and maybe meta-analyze your correlational designs separately. But it's not to say that they're excluded.
I'm familiar with what works clearinghouse approach. As far as I know, WRC was based off Canberra collaboration. But the one of the main differences, as far as I have seen, is that what works clearinghouse does not include observational correlational designs.
You are correct.
Or mixed method synthesis.
You're correct. Yep. And the What Works Clearinghouse really only reviews, they call them, group designs, so RCTs, quasi-experimental designs, regression discontinuity designs, and now single-case designs. But you're correct, they don't have those mixed method or the observational designs. Because really the What Works Clearinghouse, they're interested in the effects of educational programs and policies, and so they're less interested in maybe, what's the association between teacher quality and achievement. So it's not to say that's not an interesting question, but it's not in their purview. Good discussion. I think this is excellent. Okay, so I want to give you some templates for review questions. Don't feel obligated to use these templates, but I often find that students find it helpful, especially if they're new to systematic reviewing. These templates, if you sort of fill in the brackets with your own research question topic matter of interest, can be a good place to start. And the first block is an example research question if you're interested in the effects of an intervention. The second block is if you're interested in the correlation between two variables. And then the third, which I guess I haven't talked much about, but that's really if you're interested in essentially a mean or a median or a proportion or just a measure of central tendency. So not differences between groups, not correlations, but just, for instance, prevalence. So let's start with the first block. So if you're interested in the effect of an intervention, a good template is to assess the effects of the intervention compared to some counterfactual for some condition in a certain participant population, maybe in a certain context, on a certain outcome. Now, you don't necessarily need all of these. Sometimes you might omit condition or problem, or you might omit context. But really, and we'll use PICO quite a bit today, think about your population, that's your P, your intervention, which is your I, your comparison condition is your C, and your outcome is your O. And that PICO acronym is a useful way to formulate a research question if you're interested in the effects of an intervention. So, for instance, you might ask, does cognitive behavioral therapy work? I would say that's not a very informative research question because it's pretty vague, it's pretty broad, it's not clear what population you're interested in, what's the counterfactual, what's the outcome, what do we mean by work? So you might instead ask, is cognitive behavioral therapy more effective than psychotherapy in reducing disruptive problem behavior among high school students with conduct disorder diagnoses? Right, so that's a much more informative research question, and having a research question in this format will help you when you do your literature searches. Because essentially each of these terms in your research question are potential search terms when you're doing your systematic literature review. If you're interested in correlations or maybe looking at observational research evidence, a good template is what's the relationship between X and Y? So what's the relationship between teacher behaviors and student motivation? Well, that's a little bit broad, so let's make it more specific. What's the correlation between the affective qualities of teacher-student relationships and high school students' school engagement? So trying to narrow down those concepts, make them a little bit more specific in terms of the constructs you're interested in. And then finally, if we're interested in kind of a measure of central tendency, You might ask, well, how well can children read? Again, that's pretty vague, not a very good research question. So you might instead say, well, what proportion of fourth grade U.S. students pass state-level reading proficiency standardized tests? So we're much more specific there in terms of the population we care about, fourth grade U.S. students, and the outcome that we're interested in, which is the pass-fail of reading proficiency tests. So these are just a few examples of research questions. You don't have to use those templates that I provided, but I would encourage you to do that the first time around, and then you can refine them to make them better worded. But essentially, those will give you a good starting place to try to develop your research questions. Okay. So what I've just talked about are really what I would call primary research questions. So what's your focal research question you're interested in your systematic review? But many systematic reviews, you will see that they have secondary research questions. So they're not just interested in what's the average effect of this intervention, but they might be then interested in variability in effects. So does the effect of that intervention vary for elementary school students versus middle school students? Does that effect of that intervention vary for students, with limited English proficiency or not? Does it vary for students based on their racial or ethnic background, their socioeconomic status? All of these things might essentially be what we will call moderators tomorrow of intervention effects. So don't feel like you're limited to one research question, but really you often will have secondary research questions, and you'll see those in reviews where they try to then tease out and explore the variability in effects with their secondary research questions. Okay, so I think I've got an exercise. I'm going to try to get through this quickly here so that we can get to the exercise so you guys can start working on your own topics. But I want to mention quickly here, really thinking about study eligibility criteria. So if you've developed your research question and you kind of have a good idea of the types of primary studies that are going to inform that research question, the next step in your protocol is to define what types of studies will be included or excluded. Okay, and so sometimes it's called study eligibility criteria, sometimes it's called inclusion or exclusion criteria, but it's which studies are in and which ones are out. And so really the purpose of having your well-defined eligibility criteria, transparency and replicability, right? You want to make it transparent so that somebody could come behind you and replicate your systematic review. And so we're going to use the Pecos framework that I've already sort of hinted at before, where essentially I think it's most useful to then think about your eligibility criteria for your population or participants that you're interested in. If you're interested in interventions, obviously you want to define those interventions. The C is for comparison groups or your counterfactuals, if that's relevant. Your outcomes, and then S is sometimes used for study design. So we'll walk through each of these. And then there might be some other eligibility criteria. Okay, so I'm going to sort of go out of order here because it makes sense to start with interventions. So when you're thinking about developing your intervention eligibility criteria, you want to think about, okay, do you want to restrict to interventions that have a specific focus or content? Do they have to be delivered in a certain setting? So do they have to be school-based? Do they have to be clinic-based? Do they have to be community-based? Are you going to restrict to certain provider types? So maybe it has to be a trained physician who's providing the intervention or a trained nurse midwife. And then maybe the audience. So I don't know if you can see this very well, but I've given you the source. This is from a Campbell collaboration review where essentially they're interested in parent training programs to reduce ADHD symptoms. And so this is in their, I think this is their protocol. They actually have a very clear definition of the types of parent training interventions that are going to be included. So they say, well, parent training includes group-based interventions for an individual parent or a couple, or the combination thereof. And so then they include, or they say we excluded trials where direct interventions with the child were used. Right? So they're making it fairly clear here, what do they mean by parent training intervention? Right? And so eligibility criteria, again, are giving the operational definitions for each of the key concepts in your research questions. And so they can get quite lengthy, right? Because this is just the description for the intervention conditions. So then if we think about comparison conditions, right, if we're looking at between group studies where you're comparing an intervention to a comparison, you need to be specific about what those comparison groups can be getting. Now, an important thing to think about if you're doing this type of review is to really think if you're interested in relative effects versus absolute effects of an intervention. So if you say I'm only going to include studies that have a no treatment control condition or a no treatment comparison condition, really those types of review questions will tell you about the absolute effect of an intervention. But in most of our social science research literature, no treatment controls don't exist. Right? There's usually business as usual or some kind of alternative services that are provided, often for ethical reasons. We can't, randomize people or allocate them to not get services. So you might be interested in essentially relative effects, versus usual services, maybe some other sham treatment, or even some other presumably effective treatment. So for instance, in substance use, where we compare family therapy to cognitive behavioral therapy, those are two presumably effective treatments. And if I do a review summarizing the effects of those differences, really I'm focusing on the relative effects of family therapy versus CBT. So you need to think about this at the planning stage, because this also has implications for the types of effects that you will observe. Because in most cases, absolute effects of interventions are going to be larger than a relative effect. So you need to be aware of that, right? So if you're going to be comparing treatment A versus treatment B, that's going to give you a much smaller effect than treatment A versus no treatment. So it's just something to be aware of, but you definitely want to define your eligible comparison conditions. Yes?
So when you have a business as usual as a control group, we don't know what the business as usual, especially school settings.
Yeah.
So when you summarize the effects, how can you compare them?
Yeah, this is a tricky issue, the business as usual. And so what I would say is that if business as usual is your only comparison condition, that's fine, but you just need to be explicit about it and say eligible comparison conditions included standard educational services as usual that did not provide additional supplementary services. And so as long as you're clear about that, I didn't provide a screenshot. As long as you're clear about that, so that way people reading your review understand that that's what the counterfactual is. So again, just being clear, transparent, and documenting all of these things is what you need. Now, if you had business as usual and then some other comparison condition, I would say you might want to split the results out separately.